Delivering dire predictions about the accelerating spread of the virus, Dr. Adelstein Brown says COVID-19 cases are growing between 3 and 5% a day, meaning by mid-February, Ontario could see 20,000 new cases every day.
We are at a dangerous point.
If growth hits 7% daily, a figure that has already been seen in Ontario on some days, the number of cases by mid-February would double to 40,000 a day. But even with the less dire 3 to 5% daily growth, Dr. Brown says the number of COVID patients in intensive care is headed to a level that the health system can no longer support, between 1,000 and 1,500 beds by mid-February, and healthcare workers will be unable to give everyone the care they need.
We will have to confront choices that no doctor ever wants to make and no family ever wants to hear.
Already, provincial data shows a quarter of Ontario's hospitals have no free beds in their ICUs, including Hamilton General, Niagara Health St. Catharines, and Oakville Trafalgar. And another quarter have only 1 or 2 beds free, including Hamilton's Juravinski Hospital. Dr. Brown and Ontario Health President Matthew Anderson emphasized this increased strain on the healthcare system is impacting non-COVID patients too.
People living with cancer, with heart disease, with respiratory illness, with neurological illness, not being able to access the services that they need.
With almost 40% of all homes suffering an active outbreak and more than 1,100 deaths in the second wave so far, one of the starkest predictions is for long-term care.
Mortality in our long-term care homes is now on a pace to exceed the tragedy of the first wave.
In a worst-case scenario, the death toll will rise to more than 2,600 by Valentine's Day.
The scenarios are really quite scary.
Epidemiologist Dr. Prabhat Jha says the modeling shows how much more needs to be done to protect long-term care home residents, where the majority of death is occurring. To save lives, he says vaccinations in homes need to be drastically ramped up, and if the virus is entering homes through staff members like it did during the first wave, a program to frequently test staff and isolate them at hotels when they are not working should be instituted.
The NHL, with a lot of resources, was able to basically keep a bubble. Why can't we have that same approach for nursing homes?
Also revealed today, about a third of Ontarians are not following guidelines around physical distancing, masking, and are in contact with people outside their household. And mobility data shows Ontarians are still moving around just as much as during the summer.
Despite going into a shutdown in the gray zones, people were still moving about.
Dr. Barbara Yaffe also said that Ontarians need to be supported in making the right decision, identifying as a problem the fact that some people won't be paid for missing work due to illness. Dr. Brown also said that without social supports, it's unlikely new restrictions would be very effective. Yet today, the Ford government did not announce any new supports for workers like paid sick days.